Well, Warren, it looks like your gastritis has come back again.
What is pain, right?
Yeah, that's the irritation of your stomach from the lining of your stomach. What I'd like to do is give you a prescription for omeprazole. I'd like you to take that every day over the next 4 to 6 weeks. And also it'd be important for you to avoid anything that might irritate your stomach.
Such as what?
Like aspirin, ibuprofen. Alcohol is also irritating. I noticed that you filled out one of our alcohol questionnaires. Could I take a look at that and maybe give you a little feedback?
Yeah, there could be a couple of things in there you want to talk about, I imagine.
Okay. Take just a minute to score this. Looks like 21 points. And let me just update here about how many days a week you usually have an alcoholic drink.
Most days, probably every day, yeah.
Okay, and on a typical drinking day, how many drinks would you have?
4 or 5, less than a 6-pack, sometimes a 6-pack, but 4 to 6 maybe.
4 to 6, okay. And in the past month, have you used any marijuana, cocaine, other street drugs?
No, I don't use any of that anymore. When I was a kid, but not in years.
Any any prescription drugs in a way that's not prescribed?
No.
Okay. Well, as I mentioned, your score is 21. Can I explain to you a little bit about what that means?
Sure, I'd like to know what that means.
I have a diagram here that sort of sketches out different levels of scores, and your 21 points puts you up in this area.
Off the chart, huh?
Off the chart, yeah. You're in a category that's called major consequences and possibly dependent. Actually, some people at your level of drinking, when they stop drinking for a couple of days, they might get nervous or shaky or nauseated vomit. Did that ever happen to you?
No, that's my brother, but it's not me. But no, that never happened to me.
Okay. Well, it looks like you're in this highest category here where you've got some significant health risks related to your alcohol. What do you make of that?
Well, this is, you say alcohol related, but I mean other risks. I don't know. Healthy. I'm pretty healthy.
So you feel pretty healthy.
Yeah.
Well, let's talk a minute about your drinking, if that'd be all right. Can you tell me some of the positive things about drinking for you? What are some of the good things about drinking?
I hadn't really thought of that. I mean, it's just part of life for me. You know, I grew up in a family that drinks, and I'm in a family that drinks. My wife drinks, my kids drink. Mm-hmm. My older kids drink, not the younger ones, of course. Mm-hmm. All our friends drink. You know,
so you socialize by drinking?
Yeah, it's just part of what we do.
Other good things about drinking?
It helps me relax. It's just, it's just what we do. I haven't really thought about good things, but
yeah. Well, it's a part of family. It's part of friendship and socializing. It's a way to relax. Tell me some of the not so good things about drinking for you.
Well, I had a DUI about 18 months ago. I just got my license back a couple months back. That was very expensive, so that wasn't so good. I occasionally, I guess, get into disagreements with the wife, but everybody does, don't they? You know, occasionally I forget things. I thought it was part of getting older, but maybe it's the alcohol. I don't know.
So on the one hand, some good things about drinking for you. It's a way to spend time with family, a way to socialize, a way to relax. On the other hand, you've had this DUI that was really expensive. So sometimes leads to arguments with your wife, and sometimes you can't remember things that happened when you were drinking.
That's pretty much it.
And then now we add the health risks. As I mentioned, alcohol is very irritating to the lining of the stomach, so this gastritis is definitely related to alcohol use. In addition to that, continued alcohol use could lead to ulcers, could lead to bleeding from your stomach. Over the long haul, your risk of cancer of the stomach and cancer of the colon is elevated if you continue to drink at this level.
Well, I didn't know that. I mean, that's a little scary. I've had family members who've died of cancer, and I've seen that happen. That's not pretty to watch. So
that's kind of a scary thing for you.
I don't want that to happen. No.
Yeah. Well, let me ask you then, are you at a point where you would consider cutting back or quitting? Normally we encourage quitting for people who've got a medical problem like this until it clears. But
well, if cutting back would work, I mean, then I'd certainly be willing to do that. I mean, I hadn't really thought about quitting. I mean, I suppose I could. I did quit for a few weeks, couple of years ago, and so I was successful with that for a few weeks. And then
So you've actually done that, and you were successful, actually for several weeks, it sounds like.
Well, I gave it up, did the whole health kick thing, and detox and weights and running and all that other stuff, and gave that up pretty quickly. It was a little tiring, but yeah.
But you did it.
I could do it.
Made it work.
Yeah.
Well, let me show you a little diagram we have here. This is a ruler that goes from 0 to 10. Let's talk about how important it would be for you to cut back on your drinking now in light of what you've just learned. If 0 is not at all important and 10 is extremely important, how important would it be to you today?
Well, it's pretty important since you told me now that this could lead to cancer. I mean, that's what moved it up. I wasn't really thinking about it, but I'd say probably an 8 or a 9 on that scale.
Those are good high numbers. Why an 8 or a 9 and not a 7 or a 6?
I don't want to die. I mean, I've got 4 kids, 2 of them older, 2 of them younger. I want to be around for them.
Yeah, so the health risks are scary to you, and your family's really important to you.
Absolutely.
Yeah. Well, what about your level of confidence? Let's say you decide you want to cut back to try to get better and decrease your risk. On a scale of 0 to 10, how confident are that you could do that?
Well, I know I could. I mean, I did it before, and so I know that I can do it. So I'd say probably a 9 or a 10 on that. Yeah, I could do that.
So a really high number. Anything that would push you to a really solid 10 on that?
Well, if I got a few days or a week or so under my belt, I remember that was the hardest part before.
Yeah, first few days were tougher. Yeah, so getting those under your belt would make you really confident.
Yeah.
Well, let's talk about some next steps then. It sounds like you're at a place where cutting back is a serious option for you. What would be your next steps?
Well, it's just cutting back, taking the medicine and seeing what happens.
What's a reasonable limit for you?
Well, I could probably cut it in half, I guess. I've done 3 beers a day, if that worked for you. I'd like to give that a shot. I mean, I know that I could quit if I needed to, but if I can get better anyway without quitting, I'd like to try that first.
So with a 50% reduction down to about 3 drinks a day, and then take your medicine and say come back and see where we are in a couple of weeks?
Yeah, sounds good.
Okay.
Sounds good. I don't want to get cancer, that's for sure.
Yeah, well, I really appreciate you taking the time to talk with me and sharing. I know these are not the easiest things to talk about, but it sounds like got some things that are important to you here. The cancer risk is really scary. Your family is very important to you. So you're ready to make some changes, ready to make a 50% reduction in your drinking, take your medicine. And then we'll come back and talk in 2 weeks and kind of take it from there.
Sounds good.
All right. I believe you can do it.
Thank you.
Good luck, and I'll see you in 2 weeks.
Thanks.